guys, welcome to week 3 of PGHE. This is a continuation of the Social Theories Toolkit, and today we're going to be learning about social Theory Toolkit number 3, titled Structural Violence. This session is going to be led by Dr. Ursin Bayisenge, who is a Rwandan medical doctor. He's an alumni of the MGHT program. And he has a wealth of experience both as a clinician as well as a researcher. For the past year, Dr. Ursin has been a lecturer as well as a research associate for the Center for One Health here at UGHE, where he led a lot of initiatives that have to do with neglected tropical diseases, but also in the One Health Center programming, as well as research projects, publications, grant management, and grant application, as well as supporting students who are doing One Health projects. Before coming to UGHE, Dr. Ursin worked at the Rwanda Biomedical Center as a senior research officer, as well as the national coordinator for malaria programming in Rwanda. An experience that he led a lot of projects related to malaria and other neglected tropical diseases. He has also worked as a medical doctor in 3 different district hospitals in rural areas in Rwanda. Most recently, he has been part of a youth-led initiative where he was invited to a WHO high-level meeting on youth combating MTDs. And then now he's doing a PhD at Sussex and Brighton, focusing on social sciences and neglected tropical diseases in Rwanda. So Dr. Ursin brings a wealth of experience as a researcher, as a medical doctor, as well as an academician. So enjoy the session. That's a bit about Dr. Ursin. I will let him take over the session. Thank you.
Hi everyone, my name is Ursin Bayisenge. I'm a medical doctor. I have a master's degree in global health delivery, and I'm currently doing my PhD in social sciences for severely stigmatized skin condition, specializing especially on scabies in Rwanda. And in today's session, we are going to talk about structural violence. By the end of this session, you should be able to define structural violence, demonstrate the importance of this concept in global health delivery, use critical thinking skills to analyze and develop global health policies. As definition, structural violence was firstly described in 1960s by Johann Galtung and liberation theologians, and this term they use this term to describe social structures, which can be economic, political, legal, religious, and cultural, that stop individual groups and societies from reaching their full potential. And these structures are avoidable. Some of the examples include disparate access to resources, political power, education, healthcare, and legal standing. Structural violence is very linked to social injustice and the social machinery of oppression. Here we have 2 definitions of structural violence. The one of Johann Galtung is avoidable impairment of fundamental human needs, or the impairment of human life which lowers the actual degree to which someone is able to meet their needs below that which would otherwise be possible. And structural violence can also be often embedded in long-standing ubiquitous social structures normalized by stable institution and regular experiences. This is how Paul Farmer described it. And this, in simple words, means simply that structural violence are social arrangement because they are embedded in social and political structures. There are policies out there that are developed by policymakers and they can be changed to benefit everyone in a given community. In this picture, we are seeing two adult men with two young black girls who are being abused by them. And this is done publicly. This picture was obviously taken at a beach and there are people moving around. And as we saw in the last definition, this is a normalized experience, which should not be the case. And structural violence here is done on these two young girls. In this second picture, you're seeing young children who are sleeping on the floor. And the fact that they are poor doesn't mean that nothing can be done by their society or by their government to give them a shelter, to give them a place to live. In poor settings, we often see this kind of situation where children sleep on the street, and doesn't mean that this is fixed. This is a structural violence. There should be a policy to help these poor kids. Can we talk about violence when nobody is committing direct violence? There may not be any person who directly harms another person. The violence is built into the structure and shows up as unequal power and consequently unequal life chances. Those children that we just saw sleeping on the floor, or those two young girls that we just saw who are being abused by adult men, they're being given unequal life chances. This will affect, obviously, their future. If people are starving when this is objectively avoidable, then violence is committed. When one husband beats his wife, there is clear case of personal violence. But when 1 million husbands keep on 1 million wives in ignorance, there is structural violence. Correspondingly, in a society where life expectancy is twice as high in the upper as in the lower classes, violence is exercised. Using example, we're going to demonstrate how structural violence is embedded in different policies in different countries across the world. In this example, number one, in the US before the Affordable Care Act, 45,000 died due to lack of health insurance. Globally, 100 million people are pushed into poverty each year because of out-of-pocket expenditure on health services. So what is the structure here and what is the violence? The structure is that system of insurance in the United States and in many parts of the globe that leave poor people without access to health coverage, to healthcare and coverage. This is a structural violence because if I give an example of Rwanda, we have a system of healthcare insurance that include even the poor. People who are classified in the first and the second category of Ubudehe, who are classified as very poor, the government paid the community health insurance for them. So that means if in some part of the world, being poor exclude you or determine whether you would be insured or not, this means that this is a structural violence. Even those countries, they can definitely change those kind of policy and include the poor. Violence is that people are unable to live up to full potential. They die prematurely because they are not insured. They do not have access to health insurance, and therefore they get sick and they die prematurely. In the example number two, we're going to see how Haiti has succumbed to a structural violence for more than 150 years, 150 years. Haiti was a colony of France until 1804. Its population was mostly slaves from Africa. After a successful rebellion in 1804, Haiti declared its independence, but the French insisted that they would not recognize Haiti as an independent nation unless it paid France for its loss of slaves. To conduct trade and diplomacy and to protect against reinvasion from France, the government of Haiti agreed to pay this ransom. With interest, this payment amount to 21 billion US dollar. Haiti was paying interest on this debt until 1947. This is almost 151 years. And this is obviously a structural violence because in national system we're aware of this, but they were in favor of France. Obviously, these policies were put in place by powerful countries who thought uh, they they have right to have slaves. The fact that Haiti was able to uh, conduct a rebellion and declared their independence was not enough for these powerful countries like France at that time. And the international systems allowed France to penalize Haiti for declaring their independence. So this money could have been used for so many other development projects in Haiti, like education, economic development, or environmental protection. And this is a very good example of structural violence on a nation for almost 2 centuries. In the example number 3, the African Union defines the term illicit financial flows as money illegally and transferred or used. The most important illicit financial flow involves the misattribution of profit earned in Africa to low tax nations in Europe. By some estimate, the amount of money leaving Africa through illicit financial flows equals the amount entering through aid. So what is the structure and what is the violence? Here the structure is still the national system of corporate finance that allows money that should by law be paid to African government to go to instead to government and corporation based in the global north. This money can help in so many development projects in African government, but like health, like education, and their tax revenue denied to those African government who should normally benefit from them. In this table, we're trying to appreciate the difference between structural violence and physical violence. Because of the term violence, we tend to think that this is something that we can see, that it is concrete, but it is somehow not visible like the physical violence. In the case of structural violence, who is violent? It's a social group. It's that group of policymakers deciding uh, on which policies are advantaging them. In case of physical violence, it's an individual. It's sometimes, it is invisible. It's not always, it's invisible, but in physical violence, it is visible. Structural violence is unintended, it's a consequence. In physical violence, it's intentional. There is no direct responsibility, it's a country situation. It's a policy out there in a country that exclude the poor from accessing a healthcare coverage. But for a physical violence, there is a criminal with a weapon. Victims, they are uncounted in the case of structural violence. They are faceless statistics. But in the case of physical violence, we see faces of victims. In case of structural violence, it is more than tolerated, it is normal. But for physical violence, it is unacceptable. The cause of death or morbidity need by social analysis to find the prevention causing it in case of structural violence. But in physical violence, it is direct. It is criminal with obvious weapons. So what is the role of a global health leader? the role of a global health leader is to change the narrative, is to cultivate critical thinking skills. For those of us who are in the global health arena, we need to understand this concept, structural violence. Clinicians are not trained to understand social forces, but whatever intervention they are doing, they obviously see that the intervention they are doing depends on those social forces. They are successful, they succeed or fail because of social forces in whatever community they are doing their interventions. So they are in the article about structural violence and clinical medicine. The PIH model, they described what they call distal intervention and proximal intervention. So distal intervention are the intervention done at the clinic, and proximal intervention are intervention done in the community at the household level. And those interventions should not compete, but they should complement each other. Because what is done at the clinic, the medication, the diagnosis will not be much helpful if the patient is hungry in their home. So as global health leaders and practitioners, we need to understand those social forces influencing the success of the therapy that we want to give to our patient, or influencing the policy that we want to implement in our societies. We need to apply a human rights approach to ensure equity, universality, and find holistic solution. Also find information from multiple sources. Problem most of the time more than they look like. A patient having complication because they have HIV, and yet they have received medication or they're on medication, doesn't mean that they do not have the skills to take this medication, but there might be other social forces influencing the success of the therapy they are taking. We need to study history to avoid repetition and redesign surface delivery. I'm pretty sure that you've seen this picture. It is a package given to mothers to avoid or to stop mother-to-child HIV transmission. These are obviously not medication, but they are food packages that help those mothers who have HIV to lead a good life on their pregnancies and afterward, so that they be able to take the medication, the IRV that they're being given, and therefore result in control of mother-to-child HIV transmission, or reduction of mother-to-child HIV transmission. So to end our session, I want you to watch this video, why are African American more affected by COVID-19 virus, and discuss the following. Identify other form of long-term structural violence impinged on the Black community in the US, and propose a holistic intervention to the identified structural violence, highlighting challenges of implementation and possible solutions. Thank you.
If you have any questions, please contact your instructors. Thank you.